Meningioma. It is the most common primary brain tumor. Most of the meningiomas are benign. Okay. Meningioma, they origin from the meninges, specifically the cap cell layer of the arachnoid. Meningioma, as the name suggests, they will arise from the meninges, specifically the cap cell layer of the arachnoid, and these are attached to the dura. इसलिए एमआरआई पे ड्यूरल टेल साइन मिलता है. ड्यूरल टेल साइन इज कैरेक्टरिस्टिक ऑफ मेनिंजियोमा. Most meningiomas are benign and they have a very low chance of recurrence after the surgical removal. And meningiomas are associated with NF2. So, meningioma, it is the most common primary brain tumor. It arises from the arachnoid cap cell layer. It is attached to the dura, mostly benign in nature, very low chance of recurrence after surgery. Then they are associated with neurofibromatosis type 2. Morphology of meningioma. Meningioma is divided into 5 subtypes. First is meningiothelioma. So they appear syncytial. तो मेनिंजियोथेलोमेटस में जो सेल्स हैं वो बहुत कॉम्पैक्टली पैक्ड होते हैं और उनका सेल मेम्ब्रेन जो है वो उतना डिस्टिंक्ट नहीं होता है, तो इसलिए दे appear syncytial, that is multinucleated. So the first subtype is meningiothelioma which appear syncytial. Then second is fibrous or fibroblastic, तो इस पे स्पिंडल शेप्ड सेल्स होता है. The third type is transitional or mixed meningioma. It is a transition between the meningiothelioma and the fibroblastic meningioma. It is a combination of both meningiothelioma and fibroblastic meningioma. Then fourth is angioblastic. It has very high vascularization. Then anaplastic meningioma, it is malignant in nature. So there are 5 subtypes of meningioma: meningiothelioma, fibrous or fibroblastic, transitional or mixed, angioblastic, and anaplastic, which is malignant in nature. Then some meningiomas, they express hormone receptors, particularly the progesterone receptors. And so these meningiomas, they can get enlarged during pregnancy. So meningiomas, they express hormone receptors, particularly progesterone receptors. इसलिए they can get enlarged during pregnancy. Meningioma में samoma bodies are found. Samoma bodies are also present in some types of meningioma. CT scans or MRIs में they look like well-defined extra-axial masses. So meningiomas are well-defined and extra-axial masses because they origin outside the brain parenchyma. They do not origin from the brain parenchyma, they origin from the meninges. So they appear as extra-axial masses on imaging tests like CT scans and MRIs. And they can compress surrounding brain tissue. And it also has a dural tail sign. So these meningiomas, they are associated with the dura. तो ट्यूमर के पास में ड्यूरा का लीनियर एनहांसमेंट होगा विच इज़ नोन एज ड्यूरल टेल साइन. So meningioma, it is the most common primary brain tumor, arises from the cap cell layer of arachnoid attached to dura, mostly benign with a very low chance of recurrence after surgical removal, associated with neurofibromatosis type 2, divided into 5 subtypes: meningiothelioma or syncytial, fibrous or fibroblastic, transitional or mixed, angioblastic, and anaplastic, which is malignant in nature. Some express hormone receptors, particularly the progesterone receptors, so they can get enlarged during pregnancy. Then samoma bodies are found in some types of meningioma. CT scan or MRIs पे they appear as well defined extra axial masses. which can compress the surrounding brain tissue, and dural tail sign, it is characteristic of meningioma.